Hello and welcome. I'm Dean Becker, founder of Adaptive Learning Systems. For years, we've been teaching resilience skills to help people stay calm, stay focused, engaged, and optimistic, especially when they're stressed. I'm an expert in the science of resilience, and I want to do something right now to help you stay resilient. You probably don't have time for a deep dive, so I've designed a short program that you can listen to or watch on a break. This is Resilience Triage, and I hope it helps. So let's get started. First off, you are resilient. Were you not, you wouldn't be sitting in the role that you're in right now. But here's the thing, resilience is a capacity. It's like a fuel tank. And this COVID pandemic has knocked us all back. The fact is that it is intense. You all, as caregivers on the front line, are in a tougher position. You're not getting enough sleep. You're not getting enough exercise. You're frightened. You might be frustrated or angry. You're overwhelmed. You're lonely. But most of all, you're in a war zone. You're in a war that you didn't sign up for. And this is causing your resilience reserves to flatten and to empty. And in order to feel better, I wanted to just try to give you a few tips in the little bit of time that we have together just to help you do that. And I hope it does help. I want to kick off with a quote. This is a quote by Viktor Frankl, an Austrian psychiatrist, author, and Holocaust survivor. Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom. I think this quote really does set the stage for this conversation we're having today. What sits in the space between stimulus and response is our thinking. In other words, what we think about why something happened will determine how we feel and what we do in response. But our work shows that we all develop habits of thought that can cause us to choose the wrong response in a crisis. We call these habits of thought thinking styles. Thinking styles are habits of thinking, ways that we think about ourselves, our world, our futures. We learn them from our parents and the other significant adults in our lives. Research shows that these habits of thought begin to set up as early as age 8 and they become set in stone by age 18. They're not all bad. The fact is that they're shortcuts. They can be shortcuts when we're under stress. But very often they're inaccurate. They're not based on good data. They're based on habitual information that's coming out of our heads. The problem is that inaccurate thinking saps our resilience, and getting it wrong is no good for us. It's no good for how we feel. It's no good for our results. Now, the fact is that at Adaptive, we've developed a number of skills to help people work around their thinking styles in order to become more resilient. Flexing around the thinking styles takes work, but it only takes a few small steps to get started. Along these lines, I'd like to introduce you to a basic resilience skill that we call avoiding thinking traps. Now, what are thinking traps? They're specific, predictable ways that we jump to conclusions, especially when we don't have the data. Most of us are pretty good problem solvers when things are kind of organized and going on in a fairly rational pace, when we have the information that's coming at us as to why something's happening. But when we're in crisis mode, when we're facing adversity, when we're facing high levels of complexity and unknown, we don't have the data to connect the dots. That's when these thinking traps can jump into our head and cause us to get it wrong and to not do well. Now, there are many thinking traps. There are three in particular that I'd like to share with you today. The first is called personalizing. This is instinctively looking in the mirror, pointing the finger of blame at yourself when something goes wrong. The flip of personalizing is externalizing. This is instinctively blaming someone or something else when something goes wrong. So it's either pointing the finger of blame or cause at yourself or at someone else. Sometimes it's hard to know which way we jump, and frankly, if we're experiencing these thinking traps at all. But let me try to explain it to you. If in most cases you are finding that your emotions aren't getting in your way, if you're finding that something hits you between the eyes and you're able to figure it out, process it, and solve it, and you're not being overwhelmed by any big emotions, then the chances are pretty good that you're not jumping into or falling into these thinking traps. But let's take a quick look at what the emotionality is of each. If you personalize, if you're instinctively blaming yourself, that's going to cause emotions like sadness, anxiety, shame, embarrassment, guilt, one or two or more of these. On the other hand, if you're externalizing, pointing the finger of blame or cause away from yourself, you're going to feel frustrated or angry. Either way, take a look at what you're feeling. I cannot presume to know exactly what's happening and what you're facing right now. But if you're finding that you have large amounts of any of these emotions getting in your way, then you need to do some work around avoiding the thinking traps of personalizing and externalizing. Here's how. First, start by being self-aware. Take a breath. When we get stressed, when our resilience is low, very often our thinking gets muddy. If you take a breath or two, it can calm us down. It can help us think more clearly. Be skeptical of your thinking. Once you find out that you are a personalizer in a large proportion of the time or an externalizer, then be skeptical of it when you find yourself pointing one way or the other, because it may not be based on fact. It may be based on mindset. The hardest way to overcome these thinking traps, but the most effective, is coming up with a plausible opposite thought. What I mean by that is if you're personalizing, you're having more of a me thought. Try to come up with a plausible not me. If you're an externalizer, you are coming up with not me's. Try to come up with an equally plausible me. That is difficult. It's hard work. Give it a try. The other thing you can do that can be helpful is check in. You work in teams. You work in collaborative environments. Check in with a colleague, a trusted friend. Just let them know how you're thinking and what you're feeling, and check in to see if it's making sense to them. This is how you can avoid jumping into personalizing or externalizing. Let's take a look at a third thinking trap, also very, very common in high stress situations like the one that you're in right now. We call it magnifying and minimizing. This is being Velcro for the bad stuff and Teflon for the good. This occurs over time as the day unfolds. What magnifiers and minimizers tend to do is they will tend to grab onto the bad things that happen during the day and let them weigh them down, and they'll minimize or ignore or allow the good things that happen to just roll off their backs. At the end of the day, they're exhausted. So if you find yourself habitually exhausted at the end of the day, this thinking trap may be getting in your way. In order to fix it or avoid it, again, self-awareness is a great start. Getting off thinking autopilot is one of the best places to start in getting resilient or getting more resilient. But there's a process here, and it's fairly specific. At the end of each day, before you leave, write down 3 good things that happen. They don't have to be big things. They could be, they don't have to be. If you can't come up with 3, make up 1 or 2 to get your list up to 3. Then put that aside. The next morning, pick that list up before you do anything else and read the 3 things. Close your eyes and let those good things sink in. If you repeat this process for 17 days, you will be forming a new thinking habit, which will help you reduce the amount of time you spend magnifying and minimizing. So these are the 3 thinking traps: personalizing, externalizing, magnifying, and minimizing. Which way do you jump with me or not me thinking? We've taught you how to start to take the step to correct that. Do you magnify and minimize? And if you do, write it down, review it. I'd like to wrap up with just 3 ways that you can stay more sane and resilient right now. They're fairly straightforward, and if you try them, I believe they might help you. Here they are. Let's look at the first one. Control what you can. So often when we get stressed, when our resilience is low, we start beating our heads against situations over which we have little or no control. It's sort of the shoulds. Things should be this way. I should be that way. What is and what should be are 2 different things. And I call it howling at the moon if you spend too much time trying to control things that are out of your control. Come to peace with those things and get your hands on the levers of things you can do something about. Reaching out to others is the second. And this is one that can really provide you with a surprising loop of good resilience, because you may get home at the end of a shift and feel like there's no way I have the energy. But try it. Try picking up the phone, texting, reaching out to someone whom you haven't heard from, who you think could benefit from hearing from you. What you'll find is in the act of reaching out, you're going to get back. You're going to get back energy, thanks, and gratitude. And finally, and maybe most importantly, practice positivity. The first way to practice positivity is to try to feel more positive emotion. As human beings, we tend to be wired for the negative. Negative emotion is something we don't need to practice. It comes up naturally. It comes up because we're typically rooted in thinking about something that's happened in the past or something that hasn't happened yet. It's very specific and it's very negative. If we want to feel positive emotion, do just the opposite. Try to, first of all, calm yourself. Use a mindfulness technique. Try taking a few deep breaths. Get yourself in the present. Relax. Center. Think about something that's more general. Focus on something that's beautiful. It doesn't have to be big. It doesn't have to be complicated. If you have a window, look out the window. See the blue sky. Smell the spring air. What positive psychologists have shown us is that if we can develop and maintain a ratio of 3-to-1 of positive to negative emotion, that will build resilience. It will refill our resilience tanks quickly. Easier said than done, but it's a worthy cause. And the next thing, and another important way to practice positivity, is to practice gratitude. Now, again, this is sometimes easier said than done. If you're exhausted, we're in a pandemic now. It's frightening. We may be grieving for the way things were and not knowing how the way things are going to be. But if we can be grateful, the magnifying and minimizing practice is a good start, writing down 3 good things. But sometimes, again, you're going to have trouble. Don't look too far away from what you're currently doing. You may find, for instance, you may find that you have discharged 3 recovered patients today, and maybe you've only lost 1. That's something to be grateful for. And finally, express appreciation even for the little things that other people do for you, that you do for yourself. Here's a quick summary of what we've discussed in this short time. You are resilient, but under stress, resilience tank is drained. 3 thinking traps we took a look at. 3 ways to stay sane and resilient right now. And I'd like to thank you. I would like to thank you for your attention. I'd like to thank you for what you're doing every day in your work. It means a great deal to all of us. If you're interested in more, we've created a resource page on the Adaptive website. It contains copies of these slides, worksheets, and more. www.adaptivewithouttheelearning.com/thanks. That's www.adaptlearning.com/thanks. Thank you again, and please take care of yourselves.